Morning everyone, Dr. Eric, your fitness physician and peptide doc, continuing on my series on peptides. I'm bouncing back and forth between metabolism, hormones, and peptides. I want to talk today about melanotan 1 and 2. They're basically the same molecule, but basically variants of the alpha melanocyte stimulating hormone, and there's a 1 and a 2. The 2 is basically different in the fact that it has effects on basically more on tanning and more on metabolism support, whereas 1 is more does not. It has more of an more of the overall anti-inflammatory healing, which I'll get into a little bit. So basically, mostly I'm going to focus on melanotan 2 because it is used mostly, not as much usage for melanotan 1 because of the additional benefits that the latter provides. So again, it's this the variant of the alpha melanocyte stimulating hormone, which our body naturally produces, and again, it's involved in various things throughout the body. One of the biggest ones is involved in metabolic support. That involves your metabolism, glucose or sugar, glucose and lipid homeostasis. It's also involved in your immune system. So when people that have a lot of, I wrote AI, autoimmunity but autoimmunity conditions because of immune dysregulation plays a huge role in that. It can be involved with pigment and tanning, and of course the biggest one is cholinergic pathways. So we talked about the parasympathetic and the sympathetic pathways. Sympathetic, of course, the fight or flight, the one that kind of jazzes you up. Parasympathetic, or the cholinergic system, is the one that kind of the rest and digest. So a lot of people, we're finding it has a huge connection with the brain. You know, the cholinergic pathways transmits through the vagus nerve, which is a large nerve that runs from the brain down all the way into the body, controls a lot of that parasympathetic output. A lot of us, unfortunately, are in a hypersympathetic state, especially when we're stressed, we're overtrained, we're not sleeping, we're kind of ramped up. So your heart rate's creeping up, your blood pressure's creeping up, your cortisol's creeping up. You're more of that sympathetic state. You can't sleep, you're kind of wired. That's an indication that your body needs to balance that out. Again, it's all about the balance. We balance out anabolism and catabolism. We want to balance out the parasympathetic and the sympathetic. So most people need a little more cholinergic tone, less sympathetic tone. That has a huge role in immunity, has inflammation, fat loss, muscle gain, stress, mental function, and cognition. So balancing that is massive, and this is a whole topic in and of itself, which I'll get into in the future, but that's one of the roles that it has in this. So again, with melanotan, and awesome for immune support. Again, it balances out the different thymosins. We talked about thymosin 1 and thymosin 2, but our body makes a lot of different types of thymocytes, and your T cells and B cells is what I'm trying to say. The T cells are your T helper cells, your killer cells, the ones that support other immune. This again, I don't want to get too sciencey on this here, but a lot of times it gets a little out of balance. The TH1, the TH2, and TH17, and what's called the Treg, or the regulatory cells, the ones that balance things out. So people that have autoimmune conditions, a little too much on one side or the other. In other words, it won't recognize intracellular organisms. That's why these people have problems with Lyme disease and EBV and other viruses. The body just don't recognize those infections anymore because our innate immune system, our tracking system, is not working properly. Normally, when a virus or an infection, something comes in our cells engulf them, put these little molecules on the outside that are recognized by the antibodies or the B cells or other parts of like the natural killer cells. It basically kind of like a little like a warning, like a little attachment that our own immune system will attach onto, and then it'll engulf that cell and destroy it. So what happens is, when our immune system gets out of whack, these little sensors get hidden, and our body can't recognize it, and that's what can lead to these issues. So again, a whole lecture in and of itself, but the bottom line is that melatonin can help balance this out. So when people are overinflamed or have autoimmune conditions, they're just overinflamed, whether from stress or from toxins or whatever that may be, we'll start often with thymosin alpha and or melanotan, or both, and it really quiets down that immune system, lowers that inflammation, gets the immune system back firing normally again. Now, weeks or months later, we can start our other therapies, and now they're going to work better. So there's a science to this. There's a method to this. You don't want to just start someone on certain hormones, or perhaps a growth hormone secretagogue, or right out of the gate, because they may backfire. A lot of these peptides can not work, or a lot of these any medication can not work if you're not doing the proper thing. That's why it's important to work with someone who understands the science, a clinician. A lot of people, of course, promoting these things online who are non-clinicians, they're saying, oh yeah, try this, try that. You don't want to experiment. You want to do this the right way, or you could really mess yourself up. Very important. The other thing with melanotan 2, very much involved with cardioprotection and neuroprotection, has some help with neurologic conditions, inflammatory conditions, Alzheimer's, many other traumatic brain injuries, things of this nature, can help with myelin and protection. Massively important, as we talked about, for anti-inflammatory and decreasing oxidative stress. We all know about inflammaging, right? So inflammation and oxidation are a huge component of aging and wearing us down because of the stressors on our body today, the toxins, the bad things in the food and the water, lack of sleep, poor diet. Inflammation is the root cause of many of these things, and so this is a great anti-inflammatory. Again, someone who's inflamed from whatever reason, from an autoimmune condition, stress, micronutrient deficiencies, sometimes we have to quiet that down. Melanotan also has a big role with this one, again, metabolic support and libido. And we found out that it actually can boost libido, and it's helpful for men with erectile dysfunction or libido issues, women with libido issues. It's quite a boost in libido. And now over time it can wear off, but in the beginning it can last for some time. And again, the whole point is to get someone back on track to their normal metabolism, so probably don't need it after a period of time. But again, those first month or 2 or 3, you can get quite a boost, a decent boost in libido. Very helpful for people that have metabolic syndrome, metabolic conditions. So this is yet another tool to help get everything firing on all cylinders. And of course, the big one is on pigment and tanning. This is kind of a notice that, oh, this works with this. So I think patients with vitiligo or pigment dysfunctions, it's used therapeutically, but of course people can do it for tanning. So if someone say you're going on a trip and you burn easily, you can take this for a few days before or a week before, and it'll help you get a natural tan to protect you from getting burnt where you may be. So photoprotection is big for this, and it's natural, and if you stop taking it, it wears off. So a lot of people just want to tan, and this is a great thing for that. The other big one is metabolic support. So it can help with metabolism and appetite suppression, because the MCR4 receptor that it works on in the brain, it's one of these things like leptin and some of these other neurochemicals that affect our appetite and our metabolism. So it helps metabolize glucose, fat, helps metabolic support and appetite control. So this can be used and helpful for weight loss or fat loss. Helps get your immune system, your appetite, and your metabolic system kind of firing again. Can balance us out. So in the beginning, it can be useful to prime someone for a weight loss protocol, a fat loss protocol. We have some peptide protocols that can be helpful for fat loss, in addition to proper nutrition and fitness, of course. And then this is a primer of this. So a lot of massive benefits. And Melanotan is a really cool peptide. I'm going to continue on in part 2, a little bit more detail, what it can be used therapeutically, as well as go over dosing. So I hope you enjoyed part 1, and we'll talk to you soon. Everyone have a great day.